welcome to my channel. I'm your favorite medical microbiologist, or let's say medical professional. Today I'm going to be talking on malaria. We all know that malaria is a disease that actually kills many people every second, especially in Africa. Now, today we'll be talking about the causes, prevention, and treatment. Now, what causes malaria? A lot of people will say it's the mosquito that causes malaria. And in this case, we're talking about the Anopheles mosquito. The Anopheles is actually a vector. It carries the plasmodium. And actually, this plasmodium parasite is passed from one person to another. That is how malaria is being transferred from one person to another. It's not the mosquito, it's not the Anopheles mosquito that causes malaria. It is the plasmodium parasites. And there are different types. There's Plasmodium vivax, there's Plasmodium malariae, there's Plasmodium ovale, there's Plasmodium falciparum. And the mosquito is only a vector, it's only a carrier. That means without the mosquito, the Plasmodium parasite cannot be taken from one individual to another. What are the signs and symptoms of malaria? You have chills, fever, body weakness. Most times you're sensitive to sunlight, you develop fever, bloody stool, anemia, and to some people, they begin to sweat, they develop nausea and vomiting. Now, there are different types of treatment on the market, and the brand names which we have in our community is Coartem, we have Duo-cotecxin. You know, in those days we used to use quinine, but I think that quinine is now very primitive, and because it had a lot of side effects, you know, pharmacology has taken us and science has taken us into new medications, and now there's even a vaccine, malaria vaccine, that is given to infants that's not yet been tested on adults. So there's Coartem, there's Duo-cotecxin, and others. And during that time, it's always good to take antipyretic drugs. Antipyretic drugs like paracetamol that could help reduce the fever. There are other brands that contain paracetamol, there's ibuprofen, there's aspirin, there's efferalgan. Those are the brands that we have on the market. When we go into the prevention of malaria, firstly, a mosquito net, a certified mosquito net. Now, we have a lot of people who are selling mosquito nets that are not certified. You need to get a certified mosquito net. And how do you get that? Normally, the government, particularly in most countries, distributes this net for free. And if you look at them, you see the fiber is different. It has been coated with some form of repellent that is non-toxic to the human health. The next is wear insect repellent. This is very important. When you know you're going out in the evening, and let me say you haven't covered your legs, your arms, especially kids, use mosquito repellent on them. If you have a little baby, use a mosquito net on the child's bed, because it's just to prevent a lot of, you know, illnesses and symptoms coming and confusing the child's body when the child is still a toddler. Next point, spray insecticide in the rooms where you are. How do you do it? You buy an insecticide. There are many brands on the market. You close the windows, you close the doors, and you spray it. And after 15 to 20 minutes, you come back, you open the doors and the windows, or you open the windows, not the doors, sorry, and you allow, you know, the spray, the repellent that you have just sprayed, to go outside before you sleep in. It's also, a lot of people don't sleep with their windows open. They have to close, most of their windows are closed more often than they are open. And this causes a lot of household parasites or insects to thrive, and that is not good. You have mildew, you have fungi begins to thrive, bacteria begin to thrive, and also ventilation is also good. Good air is also good for the human health. For the human health. And it prevents you from having lung infections. I know a lot of people who have had lung infections because of poor ventilation. They are always sleeping with the windows closed, even during the day closed, because they don't have nets on their windows. Just take out some money. You must not buy the expensive one, buy a cheap one, put a net at your window, and you can open the window and close it anytime, and you won't have a problem. In some homes, some people put a second door, a light door with a little bit of wood and the net, so they can leave their door open even right up to 5-6 p.m. so that they enjoy the air and, their health can still be okay. This is particularly for those who are living on the first floor, on the ground floor of a building. The first floor of a building, swampy areas, anywhere, forest areas, or in an urban or rural area, you need to take this into consideration. Next point is clear away nearby bushes. If you live where there are nearby bushes, you're always going to have mosquitoes. You're always going to be breeding mosquitoes. And the life cycle of a mosquito is not very long. So you're always going to have them in your home. Next point is that you should drain away all stagnant water. Now, if you live in a country or in a town where the government, normally who is in charge of the roads, the civil infrastructure of the country, hasn't done their part, all you need to do is make sure that you actually create your own drainage in front of your house and by the side of your house. This will reduce the growth of, the breathing of mosquitoes around your house. And when they begin to breathe around your house will be the next area that they are going to come in. They'll look for all ways to come in. Always. Remember that insects are sensitive to the warmth of human. They will know that somebody is in that house. They will know. Definitely they will know. It is also possible that if you have a large stagnant water that is around you, you can pour a disinfectant into it. You can pour some form of oil in it. That will stop the growth of any mosquito or any form of a parasite or microorganism that wants to grow. You have to do this following the standard. There's a particular way of doing it. Next point, if you have an AC, let me say an air conditioning, you could use it. And because mosquitoes don't like cold environments, so they will not thrive, they will not live in that area. They will not live in your house. And it will keep mosquitoes away. Food that build up your red blood cells. Remember, this Plasmodium parasite breaks down red blood cells. So you need to feed on diet, have a diet that builds up your red blood cells. Next point on how to prevent malaria is you need to take prophylaxis. What are prophylaxis? Prophylaxis are not malaria treatments, are not malaria treatment drugs. No. It actually prevents the Plasmodium parasite from breaking down the red blood cells, your red blood cells. It actually stops it at that level. It just stops it. That even when a mosquito bites you, you will not be able to develop malaria. Now, this doesn't mean that if you're taking prophylaxis, you have to expose yourself to mosquitoes. You don't have to take the different preventive methods which I have mentioned here. Make up your mind to take prophylaxis. I remember while we were growing, my mom used to give us prophylaxis. That will prevent us from getting ill because we were playing out a lot. We'll always leave our doors open. We never remember to close the doors. We're always sitting out. So these are the instances where prophylaxis can come in. This is very, very, very important. Now, we've talked about the treatment, and we had some drugs like Coartem, Duo-cotecxin, arinate, that are on the market, and they have active ingredients. Now, there is something I want to tell you. It is very important that you take the malaria treatment drug according to your body weight. Many pharmacists will not tell you, or many doctors don't know this. As a medical microbiology, we did pharmacology as a little sub course, and we did pharmacodynamics and pharmacokinetics. So it is very important that when you're taking a drug, it should correspond with your body weight. It has a lot to do on how your body will react to the drug, on how the drug will react to your body. Your body weight is important. Ask the pharmacist when you go to buy, can I take this drug? Is this drug okay for my body weight? Most of the reasons why many people have recurring instances of malaria is because when they took the treatment, they didn't take the first course of treatment, they didn't take it for their body weight. So the parasite was not completely eradicated from them. Now, there are different types of ways of treating malaria. There is the tablet form, which is very popular in Africa. There's the intravenous form, that is what we take drips. And also there's the injection form. Of all of this, the one that is faster is the intravenous. The one that has to do with the drips or injection, that is it's much faster. But it is a little bit more expensive than buying, let me say, the tablets to take. Because with the tablets, it's not immediate. Your body has to break down in your body. Pharmacodynamics and pharmacokinetics has to take place. And before we actually feel relief of the symptoms and eradicate the plasmodium parasites from our bodies. So if you want to ask me, it is in the cases of severe accumulation or a severe level of plasmodium parasites in the human blood that would determine if you would take an injection or if you would take drips like intravenous treatment. But most people or most doctors would prefer, most financially because it's low cost, tablets, to take tablets and some bed rest with some antipyretic drugs. That is drugs that will reduce the fever, the temperature. So if you have any questions, please do pop it down below and I'll be here to answer. Till next time. And before I leave you, if you're joining this channel, please do subscribe, turn on your notification bell, give a thumbs up to this video, and share this video with anyone that would need this information. And if you are a returning subscriber, I want to say thank you, thank you, thank you. You are the reason that this channel has gone this far. Bye.